Phlebotomy Chapter 5, Special Blood Collection PowerPoint. Introduction. Special techniques. Patient preparation, timing of specimen collection, special blood collection procedures, specimen handling and transport. Collection priorities. Turnaround times, TATs, are based on collection priorities and will vary from site to site. Routine. Diagnose and monitor a patient's condition. Stat. Immediately. Have highest priority. Timed. Specific times. Specimens must be delivered to the lab promptly. Notify lab personnel of delivery. Fasting specimens. Responsibility of the blood collector to verify. Note discrepancies on the requisition form. Glucose, cholesterol, triglycerides, and lipid panels are most affected in non-fasting patients. 12-hour complete dietary restriction of everything except water and medications. Effects of prolonged fasting increase bilirubin and triglycerides and decrease glucose levels. Timed specimens. Measure body's ability to metabolize a substance. Monitor changes in patient's condition. Determine blood levels of medications. Measure diurnal variation of substances. Evaluate cardiac markers. Monitor anticoagulant therapy. Collection time is critical for timed specimens. It can cause improper treatment for the patient. Document the time of collection. Glucose tolerance tests. Diabetes mellitus diagnosis. Hemoglobin A1C level over 6.5%. Fasting glucose over or equal to 126. 2-hour fasting plasma glucose over or equal to 200 milligrams per deciliter. Gestational diabetes. 1 and 2-step OGTT is American Diabetes Association recommended method. Venous blood preferred. OGTT should begin between 7 and 9 a.m. Confirm that the patient has fasted for 8 to 12 hours. Draw a fasting glucose specimen. Test the fasting blood specimen before continuing the procedure to determine whether the patient can safely be given a large amount of glucose. Ask the patient to drink the flavored glucose solution within 5 minutes. Timing for the remaining collection times begins when the patient finishes drinking the glucose solution. Note the time. Specimens not collected in gray top tubes must be centrifuged or tested within 2 hours of collection. Diagnosis of gestational diabetes mellitus, or GDM, is made when the following values are met or exceeded. Fasting, 92 milligrams per DL. 1 hour, 180 milligrams per DL. 2 hour, 153 milligrams per DL. Lactose tolerance test. Ability to digest lactose. Patient drinks a standardized amount of lactose solution based on body weight. Blood collection is like that of a 2-hour OGTT. Glucose levels that increase no more than 20 milligrams per DL from a fasting specimen indicate lactose intolerance. Diurnal variation. Changes in levels of analytes throughout the day. Must be collected at specified time. If procedure cannot be collected at specified times, the healthcare provider must be notified. Substances affected by diurnal variation. Cortisol, testosterone, estradiol, progesterone, renin, thyroid-stimulating hormone, serum iron, or white blood cells. Therapeutic drug monitoring. Trough levels. Collected 30 minutes before medication is to be given. Lowest level of drug in the blood. Ensures the drug is in the effective range. Peak levels. Collection time varies with the medication and the method of administration. IV, IM, or oral. Ensuring correct documentation includes the medication dose, time and method of last dose, specimen collection time, Collections must be coordinated with the pharmacy, laboratory, and nursing staff. Red top tubes without the gel are recommended. Transport specimens in an upright position. Therapeutic drugs monitored are digoxin, phenobarbital, lithium, gentamicin, tobramycin, vancomycin, dilantin, amikacin, valproic acid, theophylline, methotrexate, and various antibiotics. Blood cultures. Aerobic and anaerobic bottles. Detect septicemia. Timing. Routine sets, temperature spikes, and pre-antibiotic administration. Collection from multiple sites. Contamination check. Blood can be drawn into blood culture bottles directly or into sterile yellow top tubes, SPS. If using a winged blood collection set, make sure to inoculate the aerobic bottle first and keep the blood collection bottle lower than the collection site. If using a syringe, make sure to inoculate the anaerobic bottle first. Use a blood transfer device. Blood cultures collected from vascular access devices must be done by specially trained personnel. The anticoagulant SPS is used for blood cultures because it does not inhibit bacterial growth. No other anticoagulant tube should be used. Gently invert blood culture bottles 8 times. Transport to the lab as soon as possible. Strict aseptic technique must be followed. Antiseptics used to disinfect the site are 2% iodine tincture, 10% povidone iodine, multiple 70% isopropyl alcohol pads, and chlorhexidine gluconate. Procedure for cleaning the arm will depend on the antiseptic being used. If using alcohol and iodine, scrub the site for 1 minute with 70% isopropyl alcohol. Follow this by scrubbing with povidone iodine or 2% iodine tincture for 1 minute. Allow to dry for 1 minute. Remove the iodine with an alcohol pad once the procedure is complete. Chlorhexidine gluconate. You scrub the site for 30 to 60 seconds and allow to dry for 30 seconds to 1 minute. Not recommended for infants. Clean the tops of the collection bottles before inoculating them with blood. Ratio of blood to media is 1 to 10. Underfilled bottles can cause false negative results. Overfilled bottles can cause false positive results. 8 to 10 milliliters is required for each bottle in adults. 1 to 3 milliliters is required for each bottle in pediatric patients. Pediatric blood culture volumes requirements are based on the child's weight. Arterial blood gases. Measure the ability of the lungs to provide oxygen to the blood and remove CO2 from the blood and exhale it. Conditions requiring arterial blood gases or ABG measurement are COPD, cardiac and respiratory failures, severe shock, lung cancer, diabetic coma, open heart surgery, or respiratory distress syndrome. You must have a thorough understanding of arterial punctures and have specialized training. Partial pressure of oxygen measures the pressure of oxygen dissolved in the blood, tells how well O2 moves from the lungs into the blood. Partial pressure of carbon dioxide measures the pressure of carbon dioxide dissolved in the blood and tells how well CO2 moves out of the lungs. pH measures the acidity or alkalinity of the blood and indicates acidosis or alkalosis. Bicarbonate buffers the blood to prevent acidosis or alkalosis. That's HCO3. Oxygen content measures the amount of O2 in the blood. Oxygen saturation measures how much of the hemoglobin in the red blood cells is carrying O2. Arteries used for arterial blood gases are the radial, which is the artery of choice, pressure easily applied, and less chance of hematoma. The brachial artery is not routinely used. It's deeper, near the median nerve, and support. The femoral artery is a last resort. It's the largest, and only trained personnel can use it. The modified Allen test assesses collateral circulation. Arterial blood gases procedure. Position patient's wrist. Patient makes fist. Compress radial and ulnar arteries. Patient opens fist. Observe blanching of patient's palm. Release pressure from ulnar artery. Observe color of patient's palm. Positive test results are equals color returning to the palm. Negative test results equals palm remains blanched. Prepare local anesthetic syringe if necessary. Support and hyperextend patient's wrist. Cleansing of site is extremely important. Cleanse the site with alcohol and allow to air dry. Inject local anesthetic per physician's order. For lidocaine, just under the skin or surrounding tissue. Pull back the plunger to check for blood, indicating a vein. Wait for anesthetic effect 2 to 3 minutes. Allow patient to relax for 5 minutes if needed. Cleanse the site and palpate the finger. Administer anesthetic if necessary. Place a clean gloved finger over the arterial puncture site. Uncap and inspect the needle. Insert needle bevel up at an angle of 30 to 45 degrees, 10 to 15 millimeters below the palpating finger. Stop when you see blood. Allow the syringe to fill to the designated level. Place gauze over the needle, remove the needle, and apply pressure. Activate the safety shield while maintaining pressure. Remove the syringe needle while retaining pressure. Expel air bubbles, apply the lure device cap, and mix the syringe while retaining pressure. Check the puncture site for bleeding after 3 to 5 minutes. Maintain pressure if bleeding has not stopped. Label the specimen after bleeding has stopped. Re-examine the puncture site. Check for radial pulse. Apply a pressure bandage, remove gloves, and sanitize hands. Thank patient and deliver specimen to the lab immediately. Appearance of blood in the syringe. The color should be bright red. The pulsation, the blood should enter the syringe without help. Patients on anticoagulant therapy will need pressure applied longer than 5 minutes. Expel any air that entered the specimen. The Clinical and Laboratory Standards Institute, or the CLSI, recommends that specimens that will be analyzed within 30 minutes should be collected in plastic syringes with no ice slurry. Specimens that can't be analyzed within 30 minutes are collected in glass syringes and placed in an ice water slurry. If air bubbles are allowed to enter the specimen, atmospheric oxygen could enter the specimen and carbon dioxide from the specimen could enter the air bubbles. If there's too much heparin, the pH is lowered. If there's too little heparin or inadequate mixing, the presence of clots will interfere with the analyzer. Delayed analysis could result in the white blood cells and platelets in the specimen continuing their metabolism, utilizing oxygen and producing carbon dioxide. Venous rather than arterial sample could result in falsely decreased partial pressure of oxygen and increased partial pressure of carbon dioxide. A hematoma could be caused by arterial blood entering the tissue. A hematoma could be caused by arterial blood entering the tissue. Tissue destruction or gangrene could be caused by arteriospasm. To prevent this, evaluate the collateral circulation. Vasovagal reaction could be caused by apprehension or pain. To prevent this, calm the patient and offer local anesthetic. Hemorrhage could be caused by coagulation disorders and thrombolytic therapy. To prevent this, use increased pressure and smaller gauge needles. Infection could be caused by failure to adequately cleanse the site. To prevent this, use proper cleansing and sterile techniques. Nerve damage could be caused by deep punctures. To prevent this, avoid deep sites or additions training for deep sites. Accidental arterial puncture. Accidental puncture of the brachial artery. You would see bright red blood pulsating into the tuber syringe. Apply pressure as you would for an arterial puncture. Document the possibility of arterial specimen. Special specimen handling procedures. Warmed specimens. Cryofibrinogen. Cryoglobulin. Cold agglutinins. Collect and deliver in a warm tube, 37 degrees Celsius. Use tube with no gels or additives. False negative results if specimen cools. Mycoplasma pneumoniae. Chilled specimens. Analytes that may require chilling. Acetone, ACTH, ammonia, angiotensin converting enzyme, or ACE, ABG, only if indicated, catecholamines, free fatty acids, gastrin, glucagons, homocysteine, lactic acid, parathyroid hormone, pyruvate, renin, some coagulation studies. Use crushed ice and water slurry. Deliver to the lab immediately. Specimens sensitive to light. Analytes: beta-carotene, bilirubin, folate, vitamins A, B12, and B6, porphyrins. Wrap tube in aluminum foil, or use amber-colored tubes. Tubes should be kept closed. Use amber-colored transport bag. Bilirubin is rapidly destroyed in specimens exposed to light. Specimen storage. Serum and plasma must be removed from cells within 2 hours. Anticoagulated tubes. Centrifuged immediately after collection and mixing. Plasma is removed. Serum tubes must be fully clotted before centrifugation. Storage time based on tests. Room temperature, refrigerated or frozen. CLSI recommendations. Coagulation specimens for APTTs are stable at room temperature for 4 hours unless patient is on heparin. PT test specimens are stable for 24 hours at room temperature. All other coagulation tests must be performed within 4 hours of collection. Blood smears from EDTA tubes must be made within 1 hour of collection. EDTA specimens for complete blood counts, or CBCs, are stable for 24 hours at room temperature. Erythrocyte sedimentation rate must be performed within 4 hours when stored at room temperature and within 12 hours when refrigerated. Reticulocyte counts should be analyzed within 6 hours of collection at room temperature or up to 72 hours when refrigerated. Specimens for glucose are stable for 24 hours at room temperature and 48 hours when refrigerated. Legal specimens. Chain of custody. Special forms, containers, and seals. Documentation of handling. ID patient with a witness. Tests. Blood alcohol, drug levels, and DNA analysis. Blood alcohol specimens. Legal blood alcohol. Clean site with soap and water or non-alcoholic antiseptic solution. Completely filled tube. Do not uncap tube. Use laboratory specified tube. Technical errors and failure to follow the chain of custody protocol are primary targets by the defense in legal proceedings. Special patient populations. Geriatric population. Gradual hearing loss, failing eyesight, difficulty making a fist, memory loss, malnutrition or dehydration. Disease states. Alzheimer's patients may be combative or confused. Stroke patients may have speech impairments or paralysis. Arthritic patients may have a difficult time straightening the arm. Anticoagulant therapy patients will require extra time to apply pressure on the site. Parkinson's patients may not be able to hold their arm still. Physiological changes. Epidermal cell replacement is delayed, increases the chance of infection. Loss of collagen and subcutaneous tissue causes vein fragility and loss of elasticity. Patients are more prone to hematoma formation. Warming the site may be required due to patients feeling cold. Arteries and veins often become sclerotic. Emotional factors. Emotional stress can alter blood composition and test results. Older patients face the loss of career spouse, family members, and friends. Patients may experience sadness, depression, and anger. Spend more time with patients to reassure them. Treat them with respect and dignity. Blood collection. Be sure to have patients state their names if no ID band is present. Evacuated tube systems are generally not the best choice for venipunctures. Winged blood collection set can be used. Collect the minimum acceptable amount of blood. Place the tourniquet over the patient's sleeve and gently release the tourniquet without snapping against the patient's skin. Blood pressure cuffs can be used for thin patients with small, hard-to-find veins. Veins in the hand or forearm are generally a better choice. Applying heat compress for 3 to 5 minutes and stimulating the area with alcohol can help make the vein more prominent. Pull the skin taut and anchor the vein firmly. Decrease the angle of the needle if needed. May have increased sensitivity to adhesive bandages or bruising. Self-adhering pressure bands are preferred. Coban. Hold pressure on the site for 3 to 5 minutes. Ensure bleeding has completely stopped before applying bandage. When possible, perform dermal punctures to avoid complications. Pediatric population. Dermal punctures should be used on children younger than 2 years of age. Keep the patient as calm as possible to prevent emotional stress. Should only be performed by experienced blood collectors. Collect only the minimum amount of blood required for the test to prevent anemia. Physical restraint may be required to immobilize the child. Use the smallest evacuated tubes when using ETS. A 23-gauge winged blood collection set with a syringe is recommended. Use micro-collection tubes when only a very small amount of blood is collected. Pediatric tourniquets are available. Assemble equipment out of the child's view. Topical anesthetic eutectic mixture of local anesthetics is ideal to use on an apprehensive child. EML applied directly over the skin with an occlusive dressing. Penetrates to a depth of 5 millimeters throughout the epidermal and dermal layers of the skin. 60 minutes to reach the optimal effect. Lasts for 2 to 3 hours. Do not use on infants younger than 1 month of age. Commercial sucrose pacifiers or nipples are available. Other methods for reducing pain and calming a child include topical refrigerant spray, breastfeeding, holding child tightly swaddled in a blanket. Antecubital or forearm veins are best choice for children older than 2 years of age. Do not use deep veins. Chapter 5, additional points from the book. Key terms. Aerobic, or pertaining to requiring oxygen. Anaerobic, pertaining to requiring an absence of oxygen. Arteriospasm, spontaneous constriction of an artery. Aseptic, free of contamination by microorganisms. Bacteremia, bacteria in the blood. Chain of custody, documentation of the collection and handling of forensic specimens. Diurnal variation, normal changes in blood constituent levels at different times of the day. Forensic, pertaining to legal proceedings. Peak level, specimen collected when a serum drug level is highest. Septicemia, the presence of pathogenic microorganisms in the blood. Steady state, a 20 to 30 minute period of controlled stable oxygen consumption and no physical exercise. Trough level, specimen collected when a serum drug level is lowest. Turnaround time, amount of time between the request for a test and the reporting of results. Test results most critically affected in a non-fasting patient are those for glucose, cholesterol, triglycerides, or lipid profiles. If the patient has not fasted, it must be noted on the requisition form. Prolonged fasting increases bilirubin and triglyceride results and markedly decreases glucose levels. Reasons for timed specimens: measuring the body's ability to metabolize a particular substance, monitoring changes in a patient's condition, determining blood levels of medications, measuring substances that exhibit diurnal variation, measuring cardiac markers following an acute myocardial infarction, monitoring anticoagulant therapy. Current diagnostic tests for diabetes include a hemoglobin A1C level equal to or greater than 6.5%, or a fasting plasma glucose equal to or greater than 126 milligrams per dl, or a 2-hour plasma glucose equal to or greater than 200 milligrams per dl after a 75-gram oral glucose tolerance test. Gestational diabetes is diagnosed with the 1-step and 2-step OGTT. During a lactose tolerance test, when the patient is lactose intolerant, glucose levels increase no more than 20 milligrams per dl from the fasting specimen. Diurnal variation. Substances and cell counts primarily affected by diurnal variation are cortisol, testosterone, estradiol, progesterone, renin, thyroid-stimulating hormone, serum iron, and white blood cells, most often eosinophils, and the levels of these substances fluctuate noticeably throughout the day. Blood cultures. Bacteria in the circulatory system is called bacteremia. Blood cultures are requested on patients when symptoms of fever and chills indicate a possible infection of the blood by pathogenic microorganisms and their toxins, septicemia. The patient's initial diagnosis is often fever of unknown origin. Because the skin is covered with bacteria, strict aseptic technique is required when collecting blood cultures. If the venipuncture needle is contaminated with skin bacteria, the microorganisms can be inoculated into the collection bottles. A positive blood culture could be from skin contamination and not from an actual patient infection in the blood. Usually, blood cultures are ordered stat or as timed collections. A blood culture set consists of blood from a single venipuncture that is inoculated into both an aerobic and anaerobic bottle. Specimens are usually collected in sets of 2, drawn 30 or 60 minutes apart, or just before the patient's temperature reaches its highest point, or spike. However, timing varies from facility to facility. The concentration of microorganisms fluctuates and is often highest just before the patient's temperature spikes. When antibiotics are to be started immediately, the sets are drawn at the same time from different sites. Specimens collected from different sites at the same time serve as a control for possible contamination and must be labeled by this collection site, such as right arm median cubital vein, and their number in the series, 1 or 2. A known skin contaminant must be cultured from at least 2 of the sites for it to be considered a possible pathogen. An anticoagulant must be present in the tube or blood culture bottle to prevent microorganisms from being trapped within a clot, where they might be undetected. SPS is used for blood cultures because it does not inhibit bacterial growth and may enhance it by inhibiting the action of phagocytes, complement, and some antibiotics. Do not use other anticoagulants such as sodium citrate, heparin, ethyl diamine tetraacetic acid, or EDTA, or oxalate because they may inhibit bacterial growth. Some blood culture collection systems have antimicrobial removal devices containing a resin that inactivates antibiotics. Blood culture bottles must be gently inverted 8 times after the blood is added. When collecting for a blood culture, you inoculate the anaerobic bottle first with a syringe, but the aerobic bottle first when using a winged blood collection set. The ratio of blood to media should be 1 to 10. Underfilled blood collection bottles may cause false negative results. Overfilled bottles may cause false positive results. Arterial blood gases. Testing of arterial blood gases measures the ability of the lungs to provide oxygen to the blood and remove carbon dioxide from the blood and exhale it. Conditions requiring the measurement of blood gases may be of respiratory or metabolic origin and include chronic obstructive pulmonary disease or COPD, cardiac and respiratory failures, severe shock, lung cancer, diabetic coma, open heart surgery, and respiratory distress syndrome in premature infants. Heparin is the anticoagulant of choice for arterial blood gases and must be present in the syringe when the specimen is collected. The type of heparin used must not interfere with any additional tests being performed on the specimen. Arterial puncture sites. The radial artery is the artery of choice because the ulnar artery can provide collateral circulation to the hand if the radial artery is damaged. It lies close to the surface of the wrist and is easy to palpate. There is less chance of a hematoma because it can be easily compressed against the wrist ligaments and bones, thus pressure can be applied more effectively on the puncture site after removal of the needle. The brachial artery, in spite of its large size, is not routinely used for arterial puncture because it's much deeper and more difficult to puncture. It's located near the basilic vein, and you could obtain venous blood. It is located near the median nerve, which, if accidentally punctured, could cause nerve damage. There's no collateral circulation when the artery is damaged. It lies in soft tissue that does not provide adequate support for post-puncture pressure, which could result in a hematoma. The femoral artery, located in the groin area of the leg, is the largest artery used for arterial puncture. Physicians and specially trained personnel collect specimens from this artery. It is used only when there is no other available site because of its poor collateral circulation, risk of infection, and increased chance of hematoma or hemorrhage. The modified Allen test determines whether the ulnar artery is capable of providing circulation to the hand collaterally. If it's negative, you may not perform the arterial puncture on that arm and should choose another site. The risk of infection is higher in arterial punctures than in venipunctures. Cold agglutinins. Cold agglutinins are autoantibodies produced by persons infected with Mycoplasma pneumoniae or with autoimmune hemolytic anemias. The autoantibodies react with red blood cells at temperatures below body temperature. Because the cold agglutinins in the serum attach to red blood cells when the blood cools to below body temperature, the specimen must be kept warm until the serum can be separated from the cells. Collect the specimens in tubes that have been warmed in an incubator at 37 degrees Celsius for 30 minutes and that contain no additives or gels that could interfere with the test. Carry the warmed tube to the patient's room in a tightly closed fist or a pre-warmed container. Collect the specimen as quickly as possible. Return the specimen to the lab in the same manner and place it back in the incubator. Failure to keep a specimen warm before serum separation will produce falsely decreased test results. Cryofibrinogen and cryoglobulin are two proteins that precipitate when cold and must be collected and handled in the same manner as cold agglutinins. Chilled specimens. Chilling a specimen inhibits metabolic processes that continue after blood collection and can adversely affect lab results. Chilling is contraindicated for some analytes. Potassium levels will be falsely increased if the specimen is chilled. Therefore, you must collect whole blood specimens for electrolytes in a separate tube when ordered with other tests that must require chilling. Chilling blood samples for prothrombin testing is unacceptable because it may cause activation of factor VII and alter test results. Pain interventions. A local topical anesthetic, eutectic mixture of local anesthetics, EMLA, is ideal for use on apprehensive child before venipuncture. You can apply this emulsion of lidocaine and prilocaine directly to intact skin and cover it with an occlusive dressing. EMLA penetrates to a depth of 5 mm through the epidermal and dermal layers of the skin. It takes 60 minutes to reach its optimal effect and lasts for 2 to 3 hours. EMLA should not be used on infants younger than 1 month of age, or if the child is allergic to local anesthetics. One side effect of this emulsion may be pallor at the site or a slight redness because of the adhesive covering. Research has shown that solutions of glucose, dextrose, and sucrose have a calming effect on infants up to 3 months. Commercial sucrose pacifiers or nipples are available. A 24% solution of sucrose may be made by mixing 4 teaspoons of water with 1 teaspoon of sugar. This sucrose solution may be given to the infant using a syringe, dropper, nipple, or pacifier about 2 minutes before venipuncture, and the effects last for about 5 minutes. Chapter 5 Review Questions. 1. The timing for an oral glucose tolerance test begins when the patient finishes drinking the glucose. 2. Specimens are collected at specific times to measure the body's metabolism of the test substance, because the substance exhibits diurnal variation, or to determine blood levels of medications before the next dose. 3. The trough level for therapeutic drug monitoring is collected 30 minutes before the medication is administered. 4. A negative modified Allen test indicates the radial artery cannot be punctured. 5. The preferred site for arterial puncture is the radial artery. 6. 2 blood culture sets from a patient requiring stat administration of antibiotics are collected immediately from 2 different sites. 7. When blood is inoculated into blood culture bottles using a winged blood collection set, the aerobic bottle is inoculated first. 8. Specimens that require chilling immediately after collection are placed in a slurry of crushed ice and water. 9. Specimens for cold agglutinins must be kept warm. 10. A falsely decreased blood alcohol level may be obtained if the tube is only partially filled. Chapter 6 for further study. Glucose levels are higher in capillary blood collected by dermal puncture than they are in venous blood, and that's why collecting every other specimen for a 3-hour OGTT by dermal puncture on an elderly patient would be unacceptable. 2. Bilirubin is rapidly destroyed by light, and therefore it would not be acceptable to leave a green stopper tube for a bilirubin test on the counter for an hour. 3. The fasting blood specimen is tested before administering the glucose to determine whether the patient can safely be given a large amount of glucose. 4. Before having blood drawn for a lipid panel, the patient should be given instructions to come to the lab early in the morning after a 12-hour fast. Case study. Failure to mix the blood bottles after the blood is added would most likely cause a false negative culture because the microorganisms present in the blood could be contained in the microclots. False negative